exercise kicked off Monday morning when we had 20 students. We had 12 of them show up at the training health clinic, and we had 8 show up at the ER showing signs of vomiting, nausea, and diarrhea.
That was Major Mitzi Elliott speaking about the public health exercise that Keesler conducted September 19th through September 22nd of 2016. During this time, the number of sick airmen increased. The public health officers saw a trend that seemed to be a gastronomical problem. To find commonality among the airmen, public health officers researched the patient's food history from the previous 72 hours. Major Elliott explains their findings.
Located the problem to the Azalea DFAC, the dining facility where the students were eating. So when we went out and investigated, we found that one of the food handlers' children was sick, and with norovirus, which is a contagious GI virus, very contagious, makes you very sick, and was handling the food on the salad bar without properly washing his hands.
On Wednesday, another group of 70 airmen fell ill and reported in. At that point, Major Elliott, as the public health emergency officer, was contacted, and a crisis action team was put into effect. The decision was made to implement the point of dispensing, or POD, at Vandenberg Hall. The POD is a location where pharmaceuticals and other medications are distributed to the patients in large emergency cases. Major Jeff Andrioli explains.
The POD stands for the point of dispensing, and the purpose of this exercise is to test our ability to vaccinate or medicate a large portion of the population in a short amount of time. It involves many teams from throughout the med group, from patient admin to triage to public health, pharmacy team, and they all work together to make sure that the base population receives the medication in a timely manner, public health emergency is prevented, and the mission of Keesler Air Force Base is maintained and can be executed.
On Thursday, the POD was opened, and 100 airmen reported in sick with what might have been a neurotoxin virus. After triage, the airmen were sent to one of 2 sign-in areas. One was for those with possible symptoms, and the other was for airmen exhibiting symptoms and in need of immediate treatment. Airmen with mild symptoms were presented a briefing and informed about the neurotoxin of which they may have come in contact, and were taught the best way to prevent the spread of the virus. Afterward, they were sent to get their medicine, have their hands stamped, and then released. The airmen already showing symptoms, some collapsing on the floor and others panicking, were helped by medical staff, and the more serious cases put on IVs and sent to the hospital. Major Elliott explains why these types of exercises are important to Keesler.
The exercise for the disease containment plan helps all the players that would be involved in it, helps them all know what their functions are when if we would actually have a disease outbreak. If this was real world, where they would put people, how they would get these items to the patients, to the people that's been exposed.
This is Andrew Whitman reporting for the 81st Training Wing, Keesler Air Force Base, Mississippi.